Good afternoon, everyone, and welcome to this news briefing to inform stakeholders, particularly the general public and the media, of a significant event that has occurred over the last 3 days. And I am referring to the Strategic Planning Workshop of the Caribbean Public Health Agency. And I know that right now you're probably asking yourself, why is a strategic planning exercise such an important or significant event that would require a press briefing, right? Well, I'll give you 2 reasons. One, because decision makers from across 21 countries throughout the region saw the need to be here, and they have made this strategic planning exercise an important part of their agenda. And 2, I would like to say that they have done this because the outcomes of this meeting, they are certain to impact not only their families, but also the health and lives of all peoples of the Caribbean. And so again, it's my pleasure to welcome you, and I would like to take just a few minutes to introduce you to our head table. Dr. Joy St. John, Chief Medical Officer, Barbados. Dr. Patrick Martin, he's the Chief Medical Officer, St. Kitts and Nevis. Dr. C. James Hospitalis, the Executive Director of CARPHA. Dr. Donald Simeon, Director at CARPHA. Dr. Rohit Doon, I'm sorry, that does not look like Dr. Rohit Doon. Dr. Lourdes Marie Bellot, and she's Technical Director, or I should say Technical Advisor and Director General of Haiti. And last but not least, of course, Dr. Rohit Doon, who is the Advisor, Public Health, Trinidad and Tobago. So ladies and gentlemen, at this time, I would like to invite CARPHA's Executive Director, Dr. C. James Hospitalis, to address you. Dr. Hospitalis.
Thank you, Madam Master of Ceremonies. Good afternoon. I'm happy to speak to you briefly about CARPHA and the importance of investing in public health and what happened over the last couple of days. We got all the member states of CARPHA together with a few key partners to really help chart the course forward towards a destination 2025 for this new public health agency. So who is CARPHA? It's the Caribbean Public Health Agency, which was signed into existence by heads of government in July 2011 and officially commenced work in January of this year. CARPHA is an international public health agency serving the region of the Caribbean on a global playing field. We recognize that. It's a merger of the 5 former regional health institutions. Those of you who know them, the Caribbean Epidemiology Center, or CAREC, the Caribbean Environmental Health Institute, which is headquartered in St. Lucia, Caribbean Health Research Council, Caribbean Drug Testing Lab, which is based in Jamaica, and the Caribbean Food and Nutrition Institute. So CFNI, which is a bit of a brand, CEHI, CAREC, CHRC, and CRDTL. And the idea is to have a more efficient, effective public health arrangement for the Caribbean to monitor and tackle the priorities that the region faces. CARPHA has, in the 5 agencies that have come into one, a lot of successful history in eliminating measles, in raising up the problem of HIV and AIDS, of NCDs and childhood obesity. But today we face new challenges, and a lot of that came out. I'll mention some of those shortly from the meeting. We also had a lot of cause for hope because we've had successes before, and we see how we can build up a strong response, strong systems to face some of the complex challenges. And the other thing that came out, I think, was that those challenges require CARPHA to work with many other sectors and Ministry of Health to work with other sectors, education, agriculture, finance, trade, foreign affairs, and so on. And then in addition, it is a need to work with civil society and the private sector, with certain exceptions like the tobacco industry. So that's in a nutshell, who is CARPHA. We do the monitoring of health problems and provide critical analysis for member states, the evidence base as it's called. CARPHA coordinates a laboratory network in the Caribbean that monitors diseases that are of significance to the world, or could be in one part of the world one day and here in 24 hours. We do capacity building and training of the countries so that they're better able to respond to threats and challenges, and conduct a lot of research that influences or informs policy, helps improve health conditions. So those are some of the functions of the agency, a little bit of the background of the agency, and building on success. As we gathered over the last 2.5 days to get input from the member states and from key partners such as the Pan American Health Organization and the CARICOM Secretariat, as we gathered over those 2 days, a lot of issues came up. Major public health concerns, such as NCD prevention, heart, stroke, diabetes, and the issue of childhood obesity as a major one. And related to that, our populations are aging, so the need to have emphasis on healthy aging. How to maintain the gains in HIV and AIDS, that's been a success, but how to maintain them, and how to strengthen the response to threats and emergencies that happen either from infectious disease or climate change threats that are emerging. We need to have a strong mechanism for responding. And CARPHA will be launching a program on strengthening applied public health training so that in the face of a threat or an emergency, we have competent, capable people who can respond and save lives and prevent economic damage. I think the other major issue that arose was the whole area of injuries and violence. The homicide rates in many of our countries being much higher in recent years. And we're very pleased that the Caribbean Agency for Action on Crime and Security Impacts, the implementation agency, participated throughout that, and we have agreed to have a follow-up meeting in which the public health programming that we bring that might help reduce violence can be brought together with the security responses that they have at Impacts. The meeting discussed also the need to have strong systems and data to be well prepared to make the case with policymakers, as well as to be in a timely manner informed of what's going on, transforming research into policy. Oftentimes in institutions such as ours and in research institutions, there's a lot of good work, but how does that really get into policy to change people's lives on the ground so that people have healthier conditions that they're living in? I mentioned already about building and strengthening partnerships, and so that strong focus of that, and all the time the need to be in work with closely with as one organism with member states. And the final message is the need to invest in health, in public health, especially in member states. Things that prevent disease, things that promote health and protect health, tend to be cost-effective policies to put into place. So I'm happy to have shared with you a little bit about CARPHA, where it's come from. It's building on success, and hopefully creating an agency that 4 or 5 years from now will be globally recognized as an agency of excellence and in preventing disease and promoting and protecting health. Thank you very much.
And we thank you, Dr. Hospitalis. Director of Research, Training and Policy Development at CARPHA, Dr. Donald Simeon, will now address you on the CARPHA response to take the words from our Executive Director, the wicked challenge of childhood obesity that we face as a region. Dr. Simeon, please.
Thank you very much, Ms. Curtin. Good afternoon to everyone. The issue of obesity is a very important one for us in the Caribbean. We are one of the regions with the highest prevalence of obesity across the board in children and in adults. But of course, the issue of childhood obesity is particularly important because they are, of course, the next generation. We have to really try to understand why it's important to address it, and of course, what are the reasons, what are the causes of obesity. Perhaps one can look at it simplistically and say, well, it's a matter of energy balance, how much you eat and how much you expend, diet, and of course, physical activity, which is correct to a great extent in that we have a challenge in the Caribbean where our quantity and quality of intake is really not what it should be. For example, portion sizes, we tend to try to eat too much, but more so the quality of our intake is really perhaps the biggest issue. For example, a study was done among school children in Trinidad and Tobago here, looking at dietary intakes, and one of the more striking issues was the intake of fruits and vegetables, which were I think 30% of the children had either fruit or vegetable at least once a day, which of course is far less than what is required. More so in terms of carbonated beverages, what we call, of course, sweet drinks, for good reason, because it's pure sugar and water. And 75% of the children had at least one of those beverages per day, which of course, again, the issue of quality of the diet is critical. So the question is therefore, what can we do about it? What is CARFA's role? I mentioned it's a very simple situation, intake and expenditure, but it really isn't that simple. Obesity is quite a complex issue because what are the sources of the diet? Where does the food come from? We produce some in the region, but a lot is actually imported. And of course, the issue of trade and what we import is critical. So we have to really look at a multi-sectoral approach to really address this critical issue. Sectors involved should be agriculture in terms of what we grow and the quantities of what we grow as well. Trade, the importation of food is critical. Education has a critical role. We speak about childhood obesity, and of course, what the children eat in school is very important. Also, physical activity. There have been policies over the years to decrease the amount of physical activities, periods for physical education. Those have decreased over the years, and we have to address that as a matter of urgency. So we have to get all those sectors involved to ensure that we can have a sustainable response. On that note, CARFA is about promotion of evidence-based action. And we looked for a long time to identify best practices in the management of childhood obesity. We managed to find one good example in the whole world that actually worked and was sustainable. It was actually in France. And they have a very successful model which is unique in that it includes both inputs from the highest level, policymakers, policy development, etc., as well as from the grassroots level. The point is that we cannot just simply expect to have interventions that would be sustainable. We have to have inputs in terms of policy. We have to have inputs of all different sectors, as I said before. But also at the grassroots level, we have to have the families involved, because we're talking about a lifestyle change, which doesn't happen overnight. We also have to be patient. So actually what CARFA is doing is we are about to launch a pilot study where we're going to actually have a Caribbean version of this French intervention, which we really have high hopes for. It will be resources intensive because the inputs would include messages to children, to parents, to getting policymakers involved. But I think, but we do have confidence that over time, this type of intervention can work, and it would also show the value of using evidence, research evidence, to really inform what we do. So I would like to end at this point. Thank you.
Thank you very much, Dr. Simeon. I mentioned before that 21 CARFA member states have participated in this strategic planning process. In this regard, I would like to now invite representatives of 4 of these CARFA member states to deliver brief remarks not only on their expectations of CARFA, but also the impact of the agency on the region's public health agenda. I would like to start us off by inviting Dr. Joy St. John, Chief Medical Officer of Barbados, to address you at this time.
Thank you very much. And I think I want to start off by talking about some of our national initiatives and the way in which CARFA has been involved. Most recently, in May, what used to be a CHRC conference. And it combines the annual meeting of Chief Medical Officers of CARICOM, as well as a scientific meeting where research is presented, produced by Caribbean presenters, researchers. And in Barbados this year, there was a difference because there was an outreach to the general public. And the topic was on childhood obesity. And so research which was produced in Barbados and also in the Caribbean was used to outline to the general public the extent of the problem with childhood obesity. And the general public had its say on the level of exercise that they think is necessary and also on the quality of nutrition. And I want to acknowledge that CARFA, this new public health agency, the newest public health agency in the world, it's such an exciting thing, has done this link between research, which is usually a rarefied atmosphere, and the general public. And I'm hoping that they will continue. And in Barbados, we want to have close links with CARFA and that kind of linkage so that the public health is translated not into just something that the people at the ministry do, but something that the general public understands. And we will continue to expect CARFA to give us assistance with being a reference laboratory, with helping us with emergencies and outbreaks, helping us with environmental health, and we would have already had a mission from the entomologists to help us with our vector control program. You know, all of us in the Caribbean have issues with dengue, and they have already come to help us this year. And we've also had a visit from their lab manager to help us with our influenza lab. Those kind of linkages are necessary for Barbados with CARFA. And we expect also that they will continue to assist us with the development of guidelines. Our national food-based dietary guidelines were developed with the assistance of CFNI, the Caribbean Food and Nutrition Institute, which is now part of CARFA. So that kind of due diligence and excellence is what we require from CARFA. But I don't only want to talk about what happens at the national level with Barbados. I also want to talk about CARICOM, or Caribbean Regional Expectations. There are several treaties that we would have signed. There are several public health initiatives that are ongoing. And we would expect that CARFA would be able to assist us with things like tourism and health, things like the non-communicable diseases. And this whole issue of health in all policies, the need to work with other sectors. It isn't just that health can do things. Health has to work with other sectors. And CARFA needs to be able to translate this to the other sectors and to the other cabinets and parliaments so that there is an understanding at the political level that in order to have a healthy nation, a productive nation, all sectors have to work together. So it's my vision that in the future, if there's a policy being written that affects all of the Caribbean, that CARFA would be called by the heads of government to say, this is what is going to work, and this is how all these sectors have to work together. And then finally, at the global level, there are some key milestones in the international arena. The most obvious of these is post-2015 MDGs. There is a developmental agenda coming out of the UN, led by the Secretary General, and CARFA has to position itself so that the Caribbean is also part of this initiative and gains from the exercise. There's also the Global Monitoring Framework for Non-Communicable Diseases. In CARFA, there resides the only surveillance of non-communicable diseases in the public health arena in this region of WHO. And I want that ability to be strengthened so that when each of the countries has to report on how they're doing with the elimination of disease and the suppression of mortality, there is a goal of 25% reduction in mortality from avoidable non-communicable diseases by 2025. I want that CARFA will be able to validate the data that shows that we are doing our part. We led in this initiative to have NCDs recognized as a global issue, and we have to play our part in the monitoring and evaluation of that effort in this CARICOM region. And I want to stop there. It's a tall order, a long wish list, but I think CARFA is up to it.
Thank you very much, Dr. St. John. I now invite Dr. Patrick Martin, CMO, Chief Medical Officer of St. Kitts and Nevis, who is ready to address you.
Thank you, Madam Chair. Good afternoon. In St. Kitts and Nevis, we hold dear the belief that good health is the principal driver of our national development. However, our 50,000 person population lacks the critical mass to effectively address all of the public health work. Case in point, obesity. 45% of our adults and 15% of our children are obese. The obesity causing food and beverages are not produced in St. Kitts and Nevis. They come across our borders. They are imported. We cannot tackle the people who are deliberately targeting our young people and other segments to consume obesogenic foods and beverages, smoke tobacco and marijuana, and use alcohol to the excess. We just can't tackle those people by ourselves. Therefore, what we cannot do nationally, we must do regionally. You get a bigger bang for the buck. And that bigger bang, one example of a bigger bang for the buck is CARFA, our regional support. So we invest in CARFA, and we are, and we continue to derive dividends. For example, in surveillance against communicable and non-communicable diseases, surveillance and response, monitoring the quality of our labs, monitoring the quality of our drugs, and other matters that were raised by my predecessor at the microphone. I also wear the hat of chair of the CARFA Technical Advisory Committee, which is responsible for advising the Executive Board on scientific and technical matters. We approach our work thusly. We ask ourselves, what are the priorities? What is the evidence that makes an issue a priority? Is there a priority pecking order? What is the chance of an activity succeeding? And after implementation, is it working? Did it work? How can things be improved? So the TAC, the Technical Advisory Committee, is responsible for keeping the organization on track and responsive to regional needs. Once again, the government and people of St. Kitts and Nevis regard CARFA as an asset. Thank you very much.
Thank you, Dr. Martin. I would like to invite our newest member of CARFA, Dr. Lourdes Marie Bellot, to the podium to address you. And that newest member is Haiti. I think I omitted to say Haiti.
Good afternoon, everybody. And it's a pleasure to be here in Trinidad to attend this meeting, which is important to us because we are a member state of CARFA. And Dr. James talked about the 5 agencies who are now CARFA. And we used to work with them on special topics. And when I say that, I refer to services we had from these agencies on immunization for measles elimination, and also when we talked about a cold, which is the type H1N1, and last April, we were really concerned when there was an outbreak of this cold in the Dominican Republic, we were really concerned. And when we had suspected cases, we have specimens that we sent to CARPHA, and I'd like to say thank you for the results. And in the region, they help us deal with this outbreak, to prevent this outbreak in Haiti. And also in the past, we had services when we have to deal with cholera in the country. And they still continue to give technical assistance to our national lab in public health national lab in Haiti. And we think that we will benefit from this technical assistance to do surveillance of disease in the region. And our lab can perform some exam, but when they perform it, we have to send it for confirmation. And CARPHA is the reference for us. And also, as a member of WHO, we signed for international health regulation. Up to now, we not implementing this, and we do ask an extension to be evaluated on implementation. So it will be glad, since CARPHA will assist us to move on this initiative. And when we consider already talked about diabetes, hypertension, cancer, and obesity. So, talk about non-communicable diseases. Haiti is willing to address this problem also, and it will be great since CARPHA continue to help to move with us in health promotion. Not only to cure, but to prevent, because our mission as a Ministry of Health is prevent, maintain, and restore health. So, in the country, we do many initiatives to organize some sectors like pharmaceutical, but we have some weaknesses. And if I have to control, we have some national industries who produce drugs, but we don't have a lab for quality control, quality insurance. Yeah. And there is an informal relationship with other countries in the region to do this. But we think with CARPHA, which is, we meet together these 21 states, CARPHA will facilitate to have a formal agreement between the countries, and especially in pharmaceutical sector. Where we did activities, we've made progress, but there is not a culture in our country for operational research, or we have some weaknesses in monitoring and evaluation. But if you monitor regularly, so you can see where to stop something, when to stop it, how to change, or how to converse such activity in another one. So we think that CARFA has this expertise, and we hope that it will continue to. We've made some progress in this area, but we still need improvement. And we said thank you to CARFA for what he did for this meeting. And it's not, sometimes the people do plan and just say, this is the plan we're going to, but this participative approach will give us the chance to succeed in the implementation. And I hope that CARFA will continue to connect every member to the other so we can go together for a healthy Caribbean region. And before I say thank you again, I would like to correct an information. I'm a technical advisor at the Director General office. I'm not the Director General. We work together. And really, as I said, for the plan to free Hispaniola, that is Dominican Republic and Haiti, from cholera, is very, very important to us.
Thank you, Dr. Belot. Haiti remains and maintains a special place in all of our hearts. I invite Dr. Rohit Doon, Special Advisor, Public Health, Ministry of Health, Trinidad and Tobago. Dr. Doon, please address us.
Thank you. Thank you, Carlin. Good evening, folks. Ladies and gentlemen. In health, there is freedom. Health is the first of all liberties. No wonder then you understand how staggeringly important this group meeting was here this past few days for us, to collaborate with our colleagues and particularly to support the development of, because they integrated planning activity, strategic plan for health of the peoples of the Caribbean. Probably about a year and a half ago, the Prime Minister announced that Trinidad will be host country of CARFA. And that brought us a lot of comfort at head office, because we were used to being next door to CAREC, forerunner of CARFA and all its strengths over the years and skills. So in that regard, we have not been by ourselves. We within the past couple of months, we had an expert team from the UN organization to assess 3 sites in Trinidad for suitability for the construction of a headquarters building for CARFA. And there's going to be a big event, because the vision is that we, as I understand it, is to have from all the 5 agencies to be consolidated into one agency, which is CARFA, and create a place so that it could rise up and become an institution in the Caribbean. Much like, we've been historically familiar with Caribbean institutions, the West Indies team, and the University of the West Indies, the CARICOM Secretariat, etc. And these institutions have global presence. And so we know that CARFA will become globally competitive after becoming a Caribbean institution. In regard to the process for development of this headquarters, we have completed a design brief. So we are well on the way to the procurement of a design. And then construction, as you know, takes time everywhere. So the horizon isn't immediate, but it will happen. We expect, and I will hold CARFA's fire to its feet to the fire for their stated mission. And the stated mission is to assist, as I interpret it, assist and strengthen countries' responses in especially, broadly speaking, in disease prevention, health promotion, health maintenance, and responses to disasters. Well, you all know here that we have an epidemic. Dr. Simeon spoke about one such response with the children. We have an epidemic of chronic disease, heart disease, diabetes, high blood pressure, cancer, etc. Well, CARFA, over the years, and its forerunners have demonstrated quite a considerable degree of skill and competencies in fashioning new ways and innovative ways of dealing with such problems. So we expect CARFA to take leadership. There must be a leader for us in the region. In this particular area, it's a common situation throughout the region. It's an epidemic proportion, Caribbean-wide, and therefore we'll hold them accountable for delivering on that mission statement. As a host country, can we expect special treatment? Well, I wouldn't tell you what I think, but but I have an idea that their very presence, and we want CARFA should be synonymous with professional excellence, academic competence, and leadership in public health. So we influence the Minister of Finance by his next budget, how it should be shaped, so to improve the economic, first the health and wellness of the population, and therefore the economic well-being of the population. So we expect that. But in addition, and more than that, I would expect that their very presence in Trinidad, we are fortunate in that regard, in that we can tap into them to build a reservoir of scholarship and young scholars. So we have to plan for the future, and how do we do that? It's the people we have to plan with. And so that more and more of our young graduates and scholars will spend more time with CARFA and in CARFA and grow into leaders and build the institution over time. And finally, I think, I don't know if that is too much to ask, but we would want to have CARFA noted for research and innovation. So thank you.
Well, thank you to Dr. Doon, and thank you all for your support and your confidence in CARFA. I would now like to open the floor for questions from the media. I would also like to ask that you please state your name and the media house that you represent prior to asking your question. I open the floor, and I think we do have a microphone at the back, which we would like to allow you to use. Can you? And I would also ask that the person at the head table to whom you are directing the question, I will allow them to come to the podium so that I will take my seat now.
Thank you. I am Miranda LaRose. I am with the News Day. Dr. Simeon, it was, who spoke about the about the you also spoke about a successful pilot that had been done in France. Is it a pilot or a program, whatever it is, but you want to have a pilot. Could you say where you will be launching this pilot, which country? Could you say also over what period, and give us more on it.
Thank you. Oh, you wanted to? Yes, thank you. It was a program that was done in France that was very successful. Northern France, I will give you more details afterwards, but for now, just to say that it was in Northern France, it has been replicated in about 12 different countries. It's actually done at the community level. There are quite a few communities in France that actually implemented the program. It is a multi-sectoral program with different players involved to ensure the success. But what was remarkable is that it was sustainable. There are a number of projects that were conducted to really address obesity, which showed some success, but after a couple of years, they were just the effects would be lost. This one is actually sustainable because it actually addressed a change in the lifestyle of the children. And of course, that takes time. So the first point to note is that we should not be expecting overnight results. It's about the prevention. Okay, yes. We actually have to identify an appropriate pilot venue. So I'm actually looking at a couple of CMOs who are very keen. I'm sure Barbados and St. Kitts, but I'm sure Trinidad as well. So you wanted in Trinidad? Yes, we have to. Just to note though, the actual program is really resources intensive. So there has to be some investment at the highest level. The country has to show that they really want it, and to invest in it in terms of the personnel and as well as the actual material, because to change behavior, as I said, it's not an overnight type of activity. It takes time and involving all the different partners. In children, as I mentioned before, the schools are important. The curriculum, the school meals, the exercise, physical activity schedules are all critical. The types of food the children are exposed to. We promote 5 servings of fruit and vegetables per day for children, but for the whole community. But is that really feasible? If everybody in Trinidad were to eat 5 portions of fruit every day, would there be enough fruit to give everyone? So these are some of the practical issues, So we promote something which perhaps isn't really feasible because the system isn't in place to support it. So that's why I say it takes time, it takes commitment from the highest level, as well as, of course, community level support. The whole issue is about positive change as well, to ensure that, that eating healthy is fashionable, it is something that is enjoyable. One has to really want to eat the right things. I mean, of course, the whole issue of advertisements is critical. Policy as well to address that. What types of environments are actually created to encourage children to eat the right foods. As it stands now, of course, the reality is a colleague made a very important observation during the T20 cricket recently. It was sponsored by one of these carbonated soft drinks. So yes, you are active, which is good. We want children to be active, but then when they're active, they're not supposed to be drinking those drinks afterwards. Water is what you want them to drink. So the point is that the environment is such that it does not encourage healthy lifestyles, and therefore that leads eventually to obesity. The issue of carbonated beverages is really one that is particularly important because of the fact that there are many other implications in terms of the empty calories. The micronutrient status of the population is also very much unknown. If we are not eating the right foods, it means that there could be a lot of implications in terms of micronutrient deficiency and, of course, the effects of that on children's learning, etc. So there are many issues involved in such a program to really result in a type of behavior change that will result in decreased obesity as we go forward. Just one last point is that an obese child is also more likely to become an obese adult. 2 of every 3 obese children will become an obese adult with all the implications for chronic diseases, diabetes, hypertension, heart disease, etc. So we have to address it from young to ensure that the next generation, is much healthier than we are now.
And how soon are we looking at launching this pilot?
Next year.
Next year?
Yes, next year, yes.
that a research was done about some statistics. Was it
Yeah.
for Trinidad and Tobago? Was
Yes.
research done in Trinidad and Tobago? Was it
Yes.
statistics throughout the Caribbean?
Both. We have for throughout the region, we also have for this country, 2 large surveys were done recently of about 2,000 children each. And what they found, quite a few interesting findings, one of which was that 23% of the children were obese, and about 26% of them were also overweight. So 49% of them were either obese or overweight. Half of the children in schools, secondary and primary schools, were obese or overweight, which of course is a major issue. They also found quite a few type 2 diabetes children. This is adult onset diabetes in school children. So it is a problem that we face in the schools. And these are recent data, recent surveys done in Trinidad and Tobago. The picture is the same throughout the region. As I said, in the region, is one of the highest rates of obesity in the world. Whether it's Barbados, whether it's St. Kitts, throughout the region, we have very high rates of obesity. We have to do something about it urgently, and starting, of course, with the school children. But, of course, we also know that with a change in that lifestyle, it will also impact on the adults. Because the home, the families is where the change must start. To encourage the children and, of course, to provide a supporting environment to ensure that they increase their levels of physical activity, as well as they change how they eat, more fruits, vegetables, less, I won't say junk food, but less of those unhealthy foods.
This would be for Dr. Hospitales. You spoke about CARPA launching a number of programs to deal with public health issues. Were these programs that you are to launch, did they come out of this meeting that was held here? And could you say what? I know you mentioned some, but could you repeat them?
Thanks. The program that I mentioned that we'll be launching a bit later this year, October, is one of capacity building in public health that trains public health officials in how to respond to threats and conduct an epidemic investigation, for example. The planning of that commenced quite some time ago, and that is in collaboration with the U.S. Centers for Disease Control. Other programs where there is a need in the member states and where CARPA has a particular specialized capacity to respond were identified as a result of this process. For example, the issue of childhood obesity, I should say, was re-identified because since the last year or two and at the CARPA Scientific Conference in April of this year, that was really given a lot of prominence. The cost of that, the impact of it, and so that's why we were saying that next year we'll be looking to launch something more structured, taking on board all the evidence of what works from France and adapting it to our situation, getting our technical advisory committee to look at it in detail, and then making and implementing a plan with countries. Injuries and violence. That's the other one that we've been having conversations with impacts, with the UN, on how to, with CARICOM itself, on how can we, from a public health point of view, bring thinking about things like alcohol control, about conflict resolution training for children, gender sensitivity training, other prevention, in the same way that there is science behind childhood obesity prevention. And that's been hard to find where countries have been successful. So France has been successful. With injuries and violence, there's success elsewhere. With traffic injuries, there's almost a formula of what to do to prevent traffic injuries. And in terms of injuries and violence, to combine our efforts with impacts and government's efforts, which are focusing on the security side. I mean, they're focusing on crime prevention, focusing on narcotics, programs for disarmament, considering a range of things. And the public health side focuses on the prevention, on creating a better home environment, better community environment, alcohol control. I come back to that. Alcohol contributes to a lot of problems both domestic violence, but also traffic injuries, mental health problems, productivity in the workplace. The impact of alcohol is tremendous. So focusing on that helps to control injuries, but also helps to control high blood pressure, improves the employees' participation at work and so on. So that, we don't have a date for announcing something yet. Stay tuned. I guess I could add tourism and health, because that came up strongly in recent years and with the technical advisory group. And in fact, next week we sit with CTO, the Caribbean Tourism Organization, to do some joint planning for how to, including training in food safety in the hotel and tourism industry and certification, monitoring and rapid response systems for when something does happen, so that you protect the health of the worker, you protect the health of the community and the visitor community. And that's being developed in collaboration with the CTO, the Caribbean Tourism Organization, and the US CDC, the vessel sanitation program that monitors cruise ships. And I will, in due course, make an announcement that we will launch something, and that will probably be next year. Thank you.
Thank you very much. We have come to the end of the media briefing. I would like to thank you for your participation, for your attendance, particularly the media, and we look forward to your continued support in assisting CARFA in disseminating our public health messages to the public, our external stakeholders. Thank you so much again.
Our launch to lunch.